I want to thank you for choosing Rehab to perform. We know that you have a lot of different options when it comes to your personal health and well-being, and I can't thank you enough. Hi, my name is Dr. Josh Funk. I'm a physical therapist and the owner. I'm here today to overall set your expectations about what you should be going through on your first session. Your first session with Rehab to Perform will be for an hour. This will consist of evaluation and treatment. The evaluation time period will also include conversation and assessment. The conversation will be a past, present, and future as it relates to you. You will share the things that you used to do or that you have had work for you previously. You will share how your injury or surgery is affecting you right now. And then you will also share the things that you are hoping to eventually be able to do. We will transition from the conversation time period into the assessment. During the assessment, we will physically test your body. We will see what you can do and what you can't do, as well as better determine what is painful and what is pain-free. By the end of this time period, we hope to understand whether or not there are limitations, inabilities, or asymmetries that we need to focus on during the treatment time. We will then transition into the treatment part of the session. During the treatment part of the session, you could potentially experience 3 different categories. The first one is manual therapy. This is a time period in which somebody may have their hands on you in terms of the muscles or joints. They could be using instruments or some kind of tools to create a response in your tissues. And we could also be doing something called dry needling. The second category is our movement or exercise block. During this particular time, you will be moving around and going through things that are either going to benefit you in the session or potentially between sessions. But it is an expectation that movement is a significant part of you making progress. Then, to close the session, we'll be going through a little bit of education and writing your home program on the whiteboard. This is where we should have a full understanding and alignment of what is expected of you in terms of modifying your routine or doing things that are going to be beneficial to your short and long-term progress.